You're watching Talk with Audrey. Welcome back. Every day, more than 115 Americans die after overdosing on opioids. And one of the most powerful factors driving opioid dependence and addictive behavior is opioid withdrawal. And joining me today to discuss this growing health problem is Dr. Danesh Alam from the Feinberg School of Medicine at Northwestern. Good morning, doctor.
Hello.
What are the latest misuse rates of opioids?
The numbers continue to be of significant concern. Last year, we had over 70,000 individuals that we lost to opioid overdose. We continue to lose over 200 individuals every day. Most of these individuals are, tend to be between the age of 17 and 55. So it remains an issue of significant concern to our society.
That's a staggering number of deaths attributed to opioid abuse. Well, I understand that there's a high rate of relapse for those in recovery from opioid misuse. Why is that?
It's a good question. The opioid use disorders, they are considered to be chronic relapsing diseases of the brain. And what is really important is to understand the impact of withdrawal on the maintenance of this disease or the relapse. So the fear of relapse or inadequately treated withdrawal, the fear of withdrawal, inadequately treated withdrawal, partially treated withdrawal, all of these contribute significantly to frequent relapses.
What is opioid withdrawal syndrome and what are the symptoms?
So opioid withdrawal syndrome is, a well-recognized and studied syndrome that patients experience within a few hours of abrupt discontinuation of opioids. Patients will describe this as, the worst flu of their lives or the worst headache of their lives. When patients come into Northwestern for treatment, we do an exam where we, look at their pupils, general physical exam, study tremors, etc. Typical symptoms are, nausea, vomiting, severe chills, sweating, runny nose, teary eyes, rapid heart rate, restlessness, anxiety, agitation, depression, and even suicidal ideation sometimes. And these withdrawal symptoms can be very uncomfortable. Patients often describe this experience as if they feel like they're going to die. So one can understand why they go through all kinds of efforts to maintain the addiction to avoid that experience.
How are withdrawals addressed?
Well, in our field, we're very excited about the introduction of Lucimera as one of our treatment options. It is the first and only non-opioid medication that helps us, treat patients and help them abruptly discontinue opioid use. It can be used at any level of care, including outpatient, if the physician is comfortable doing that. We would recommend doing this under the care of a physician. The medication has, some side effects like any other medication, lowering blood pressure, lowering the heart rate, some dizziness, and dryness of mouth, that sort of thing. Otherwise, it helps us transition patients off of opioids in a week's time or even less.
Doctor, where can my viewers go for more information?
Well, they should work with their physician or go to lucimera.com.
I appreciate you joining me.
Thank you.